Okay, we did cover this once recently. It's called the short foot exercise, and what we're looking at here is creating a balance point between the heel, the little toe knuckle, and the big toe knuckle. And the way to create that magical arch is to just extend the toes. All right, so keep that visual in mind as I go to the Boditrak now. In clinic, one of the tests I'll use is single leg stance. Single leg stance and failing single leg stance, that being 10 to 20 seconds, eyes closed on one leg without wobbling, airplaning, is a good indication of somebody who's going to have a predisposition to low back pain. In other words, studies show that if you're not good at this single leg stance, it's a good chance that you're going to have low back pain, or that there's a correlation factor there. All right, so we want to rule that out, and it's one of our screens that we do with our TPI screens. And it's something that I use the Boditrak for, to give me biofeedback for the patient, client, player, and also to teach them this short foot exercise. So let's go over here and try that. If I come in here, Christine, if you can get on the board there, we'll see me with both feet on the platform right now, and it'll center out, okay? And I can get centered fairly quickly there, all right? But now, if you focus on my foot, what we're going to do now is go to a single leg stance, and I want to see how I do on my single leg stance. Now come back up and focus on the monitor if you can, and I can get pretty good at finding that 50-50 spot. All right, I can do it eyes closed, and then I can actually start to walk and do fire hydrants and all kinds of drills while I'm using the Boditrak for my biofeedback. This is a great tool to use in the clinic, and it's another way to get connected to what that golfer needs, which is footwork and balance. All right, so let's take advantage of this technology.